Topic: Therapeutic hypothermia after out-of-hospital cardiac arrest in children. Definition: during cardiac arrest, blood doesn't flow to the organs of the body. The brain may also not get enough blood. The lack of blood flow can cause lasting damage to the brain. The person may be unable to regain consciousness. Lowering the body temperature right away after cardiac arrest can reduce damage to the brain. The chemical reaction of the body slows down and also lessen inflammation in the brain, that raising the chances that the person will recover.
When a newborn baby's brain is deprived of oxygen, the cells die. And that dying away is ultimately what's causing cerebral palsy and other long-term consequences. And until about 2000, there was nothing that we could do to prevent the inevitable. And now, thanks to research throughout the world, we've actually been able to move the first treatment into clinical care. It's a treatment called hypothermia. We actually cool the baby down for 72 hours after they're born. And with this therapy, we've now doubled the chance that a newborn has a healthy outcome.
There's also different facets of research here at CHLA that adds on to the basic standard of care therapy. And this includes an early MRI, which we can quickly tell you what the brain looks like, how it's the extent of damage on the first day to second day of life. Conventionally, it is 3 days of cooling period. It's usually a period where no one wants to move the child and there's not much diagnostic imaging happening. And that's because no one wants to compromise hypothermia therapy. No one wants to transport a baby while they're being treated for a brain injury. About 5 years ago, during my fellowship training, I developed a transport protocol that safely brings babies down to the MRI during hypothermia therapy.
We take these infants and we bring them down from the NICU down to radiology, bringing the entire NICU with us, from all the NICU staff to all the equipment, so that we never change their level of clinical care. So MRI gives us an ability to look deep inside a newborn brain, where they're most vulnerable to injury. And we have one of the world's leading experts in MR spectroscopy. We cannot just get an image of the brain, but actually get a measurement of what's happening biochemically inside the cell. What we are working toward is being able to use the information in these early MRIs to essentially stratify infants. And from that, we build a roadmap for the next round of therapies. So we can ultimately identify which infants can we treat and how can we best treat them.
Applications in medicine. Therapeutic hypothermia is a type of treatment used for people who have a cardiac arrest. Cardiac arrest happens once the heart suddenly stops beating. Once the heart starts beating again, healthcare providers use cooling devices to lower your body temperature for a short time. It's lowered to around 32 Celsius to 34 Celsius. The treatment usually lasts about 24 hours.
So cooling allows us to drop the work that the brain is doing. It also has anticonvulsive properties, meaning it actually changes the neurochemicals so that it's more difficult for the brain cells to fire off. We don't, again, want to suppress the brain activity, but we do not want it to do bad things such as seizures, which is what an acutely injured brain can do to tell you, I'm not feeling well. And so cooling, again, has anticonvulsive properties, making it more difficult for those brain cells to have seizures. It can have anti-inflammatory properties, meaning reducing the edema and swelling, just like when you put ice on a sprained ankle. And it can also decrease the ability of that brain cell to undergo cell death, or what we call apoptotic cell death. So this is why cooling works. It's not affecting just one mechanism of how the brain can be injured, but multiple mechanisms. And probably.
Cons and pros. Cons. Another abnormal heart rate, especially slow heart rates. Severe blood infections, sepsis. Blood is less able to clot. This can cause bleeding, electrolyte and metabolic problems, raised blood sugar levels. Pros. Many studies have shown that hypothermia can prevent cell-injury, burn, apoptosis, and prevention of mitochondrial dysfunction. Decay destructive processes such as calcium influx, accumulation of glutamate, are also blocked by hypothermia. Hypothermia suppresses ischemic-induced inflammatory reactions and release of pro-inflammatory cytokines. It mitigates reperfusion injury by reduction in lipid peroxidation and productions of leukotrienes, nitric oxide, and free radicals.
Therapeutic hypothermia.
Studies have shown that therapeutic hypothermia has neuroprotective effects if instituted prior to the secondary energy failure phase, thus decreasing the severity of brain injury. Therapeutic hypothermia reduces cerebral metabolism, decreases the rate of cell death, and delays the cascade of metabolic changes that occur with HIE. Our original guidelines and inclusion-exclusion criteria were adapted from the landmark studies completed back in 2005. As evidence has emerged from clinical trials, we have modified our protocols to incorporate the latest information. We have a multi-facility neuroprotection group that meets regularly and rigorously discusses new evidence and shared clinical practice. Here at BCH, we use the following inclusion criteria. There are 3 distinct criteria that need to be met, such as age and weight greater than 36 weeks and greater than or equal to 2 kilos, evidence of perinatal distress, which can be seen in the fetal period or postnatally, and neonatal encephalopathy. Examples of
Issue applied in Ecuador. Among comatose children who survive in hospital cardiac arrest, therapeutic hypothermia, as compared with therapeutic normothemia, did not confer a significant benefit in survival with a favorable functional outcome at 1 year. Conclusion. A large body of evidence suggests that hypothermia can be used to prevent or limit damage to the injured brain and spinal cord, and perhaps the heart, in select categories of patients. It is important to induce hypothermia as quickly as possible, as protection appears to be greater when cooling is initiated early.